Yesterday I outlined the corporate structure as we understand it to be and the relationships between Bayer, Qatar and Miles. Most of the documents that we're going to look at will refer to Qatar rather than Bayer, but from time to time we'll see Bayer documents. In terms of the issues that we're going to look at today, I'm going to start by looking at material relating to the licensing history for the factor concentrates manufactured by Qatar in the US, but the licensing history in the UK in relation to Co-8 in its various incarnations, which was the factor 8 concentrate, and Co-9, which was the factor 9 concentrate. It's right to note that Qatar also manufactured other products, including Gamma-Immune and immune globulin. There is quite a lot of interesting material relating to that, but I'm not going to have time to touch on that or still less do it justice today. So it may be that that's something we can deal with by way of a separate written note in due course. Having looked at the licensing history, I'm going to then look at some material which relates to the market share in the UK for the product and product usage in the UK of the Qatar manufactured concentrates. I'll then turn to look at issues relating to donor pools, plasma supply, and there are some particularly interesting documents in relation to prison plasma as regards Qatar, and donor screening and selection. Again, that won't be a comprehensive narrative because we're going to come back to a number of those issues in early November. And then lastly, I'll look at the data sheets, product labels and package inserts. Again, we don't have a complete picture, but we can get a sense of how in broad terms warnings were expressed over the years or indeed were not expressed. As I hope will have been clear both from what Mr. Hill said last week and what I said before we started with ARMA on Tuesday, this is not intended to be a comprehensive, still less an exhaustive account of the activities of the pharmaceutical companies. The aim is to give an overview and to draw out some of the most interesting issues and some of the most interesting documents. Obviously, we're coming back to knowledge of risk and response to risk of infection in November. But in the meantime, if there are documents or issues which core participants or the recognised legal representatives identify that we haven't referred to, we very much hope they'll flag them up to us so that we can incorporate them either in November or by way of a further written note in due course. So against that background, I'll start then, against that introduction, I'll start by looking at some material relating to the licensing history, beginning with Co-8, the factor 8 concentrate. We don't have a complete set of licensing documents in relation to Co-8, and we have a partial picture. But it's enough to tell us, I think, the basics. If we begin by looking at BAYP 501_098, please, Shomik.
There must be a
sorry,
zero
BAYP 601_098. My apologies. So we can see this is a file containing supplementary particulars in support of the product license application for Co-8. And this is an application submitted in October of 1975. If we go over the page and we look at the index, we'll see the range of information that was submitted. So there are supplementary particulars and then a number of attachments, including the proposed package insert, and then a second file, which I'm not going to be looking at, contains what's said to be scientific evidence, chemistry and pharmacy. And then if we go to the next page, a third file with reports of clinical trials and studies. So that's the kind of material that would be submitted in the 70s in support of a product license application. If we go to the next page, please, I'll just look at the basics of the application. We can see the product for which the license was sought was anti-haemophilic factor Co-8. And at this point in time, the application was made by Bayer UK Limited. As we'll see, it was in due course, in fact, held by Spaywood Limited for a period of time. If we go to the bottom of the page, we'll see the date of the application, 16th of October 1975. And then if we go to the next page, we've got a description of the product and how it was supplied. We can see reference there to attached package inserts in relation to contraindications, precautions and warnings. Method of retail sale or supply is described as being by direct government contract and private sale. And then we can see the manufacturers, who were Cutter Laboratories, Inc. In California. And then if we go to page 7, please, we'll see that the information that was provided by the applicant included copies of labels, and then reference was made to applications in other countries. COAT's been passed by the FDA for marketing in the USA. If we go to the next page, sorry, 2 pages further on, we can see here what I think was intended to be the draft package insert, and you'll see the heading above description C, sections entitled Indications and Warning for Description of Hepatitis Risk. If we go over the page, there's a number of matters set out, but if we go towards the bottom of the page, the section in capitals above the heading Action reads, "This product is prepared from units of human plasma which have been tested and found non-reactive for hepatitis-associated (Australia) antigen. Unfortunately, this test does not with certainty preclude the presence of hepatitis virus, see warning." And if we go to the next page, under the heading Indications, in the second paragraph, we have again in capitals the word caution, because of the possibility that any lot of COAT might contain the causative agents of viral hepatitis. Its use must be considered in light of this hazard, particularly in persons with few previous transfusions of blood and plasma products. And then, if we look at the next paragraph, it reads, Casper and Kipnis have concluded that those who had little exposure to blood products had a high risk of developing hepatitis after introduction of clotting factor concentrates, such as this product. For those patients, especially those with mild haemophilia, they recommend single donor products. However, for patients with moderate or severe haemophilia who have received numerous infusions of blood and plasma products, they feel that the risk of hepatitis is small. They believe that the clotting factor concentrates have so greatly improved the management of severe haemophilia that these products should not be denied to appropriate patients. So pausing there, this, in contrast, I think, with what we've seen in relation to some of the other package inserts or leaflets, essentially contains a degree of guidance addressed, I think, clearly to the clinician rather than to the patient, about the cohorts of patients for whom the product might or might not be appropriate. And then if we go to the heading warning, it says COAT concentrate is a purified, dried fraction of pooled plasma obtained from many donors. Since the presence or absence of hepatitis virus in COAT concentrate cannot be proven with absolute certainty, the presence of such a virus should be assumed, and the hazard of administering COAT concentrate should be weighed against the medical consequences of withholding it. So again, it could be said there's a direction to the clinician, or advice to the clinician. And then the last paragraph, since there is this definite risk of hepatitis, we suggest that the physician give consideration to explaining to the patient or the patient's family the relative risks of giving or withholding this product. Then, should the patient develop hepatitis as a result of the injection, it will not come as a surprise, and there is not nearly the likelihood of resentment which will almost surely follow an unexplained and unexpected infection. And then in relation to this same document, if we go to page 16, we can see the heading warranty, and in the second paragraph, you'll see there's an italicized section. I'll just read the sentences before that to put them in context. A number of factors beyond our control could reduce the efficacy of this product or even result in an ill effect following its use. These include storage and handling of the product after it leaves our hands, diagnosis, dosage, method of administration, and biologic differences in individual patients. Because of these factors, it is important that this product be stored properly and that the directions be followed carefully during use. And then this, and that the risk of transmitting hepatitis be carefully weighed before the product is prescribed. So that's some of the material from the product license application. If we look next at MHRA 309277, we can see here some comments. So there's a date, top right-hand corner, 3rd of November 1975. Reference is made to the manufacturer, Cutter Labs Inc. in California. And then we have a description of the product, COAT. If we go down further, it's fairly faint, but it looks as though there's a box identifying which committee should look at this, biological or, I'm not entirely sure what those faded words say, but I don't think it matters. And then we can see the comment which suggests consideration by the medical assessor, Dr. Andrews. It was agreed that after scrutiny by Dr. Andrews, this application might be suitable for processing through the licensing authority. Should the application require to go to the committees, it was noted that further copies would be required. And then there's a note 9, further copies required, requested 10th of November 1975. It's not entirely clear what that means. It seems that there might have been a suggestion that it wouldn't need to be looked at by the committee, but the request for further copies suggests that the intention then was that it would be looked at by the committee. In any event, we can pick up what subsequently happens. Starting at BAYP 5022_097, BAYP, oh, we got it, thank you. So this is dated the 24th of December 1975. It is, I think, an internal note, so internal to Bayer, but it's recording a telephone conversation with Dr. Andrews of the DHSS. The product license application for COAT appears to be going through the machinery at the ministry and is being looked at by Dr. Andrews on the medical side and Mrs. Pratt on the chemistry and pharmacy side. During the course of conversation, Dr. Andrews mentioned that the Minister is personally vetting all submissions on Factor 8 because there is a lot of publicity and emotional feeling about it at the moment. Just pausing there, this, of course, is the month in which the World in Action documentary had been broadcast. And we saw from the documents we looked at in relation to the ARMOR application, which was being considered around the same time, the direct involvement of the Minister of Health, who was Dr. David Owens at the time. And then continuing with this, apparently the price of our product will be important and will probably affect the success of our application. Dr. Andrews suggested that as soon as we are granted a license, we resubmit a tender to the supplies division of the DHSS. He mentioned that the Cutter product looked good because each plasma donation is tested by RIA for hepatitis, and there have been no reported cases of hepatitis since it has been introduced into the USA. All being well, the submission will go before the Biological Subcommittee on the 9th of January 1976.
The Casper and Kipnis report, to which reference is made earlier, I'd like to know whether that just deals with hepatitis B or with both B and non-A, non-B.
I don't know.
I think it may do the latter from memory, but this is working from memory.
I'm just checking the date. So I don't have a copy of the report, and I don't think it's one I've read, so I'd need to do that. But it's a 1972 publication.
Ah,
So I suspect it may be dealing with
Just B.
hepatitis B only, given the date. It's a publication, and I'm looking at the footnotes in the reference footnotes in the licensing application. To Casper and Kipnis, it's hepatitis and clotting factor concentrates. It's published in JAMA 221.
yes, it's the reference is IRCH 302893_003 for those who want to find it.
Thank you. And it's in any event, the date is given as 1972. So I would anticipate hepatitis B as the subject matter of it, but we'll read and check that, sir.
That was one in which they said in that article that for older children and adults who had had little exposure to blood products, especially those with mild haemophilia, single donor products were preferable. And I think that's partly reflected in the application.
Yes. Yes, it sounds as though it is a not unfair account that's given in the application, but we'll double check that. And then returning to the document on screen, obviously it's the Bayer individual's account of the telephone conversation, and we don't know what Dr. Andrews would say in relation to it. The interest of the minister is consistent with what we saw in relation to the armour material. The suggestion that price will be important and will probably affect the success of the application is perhaps somewhat surprising and concerning in relation to the role of the licensing authority and the factors we would have expected them to be considering, as opposed to the kind of factors the supplies division of the department might consider, where price might then become an issue. But in any event, it is what it is.
I mean, it's what you showed me earlier, or what I was shown earlier in the week, or last week, on the 1968 Act, was that there are, of the three main criteria, cost is not one of them. But they're not the only criteria.
They're not, no.
And so it was open, I suppose, to the committee to consider cost, but it's not a primary consideration.
No. And certainly not when one considers matters of relative weight. One would expect that for the committee, issues such as safety and efficacy would be the kind of considerations that would carry the greatest weight, or should carry the greatest weight. If we then turn to MHRA, can we just go first of all to BAYP 5020_007? So this is another internal note. The date is the 7th of January 1976. We just need to look at the first paragraph, which is headed Co-8. A product licence application was made in October 1975, and it is expected to go before the Biological Subcommittee of the CSM this week. The Ministry have suggested that as soon as the licence is granted, we resubmit a tender to the Supplies Division of the DHSS. They say that the Cutter product looks good because each plasma donation is tested for hepatitis, and there have been no reported cases of hepatitis since its introduction in the USA. Now, whether that's just a regurgitation of the previous conversation or reflects some further dialogue is not clear from the material. And then if we go to the documents we have relating to the subcommittee's consideration, it's at MHRA 0009305. We can see here the date is January 1976, Subcommittee on Biologicals, and we can see here the recommendation. On the evidence before them, the subcommittee recommends the grant of a product licence for this preparation for the purposes indicated in the application on condition that, and then there are a number of conditions. The first is that satisfactory information is provided on A, the number of donations in each pool, B, the number of donations in each pool, C, the number of donations in each pool, D, the number of donations in each pool, E, the number of donations in each pool, F, the number of donations in each pool, G, the number of donations in each pool, H, the number of donations in each pool, I, the number of donations in each pool, I, the number of donations in each pool, J, the number of donations in each pool, K, the number of donations in each pool, L, the number of donations in each pool, M, the number of donations in each pool, N, the number of donations in each pool, O, the number of donations in each pool, P, the number of donations in each pool, Q, the number of donations in each pool, R, the number of donations in each pool, S, the number of donations in each pool, T, the number of donations in each pool, U, the number of donations in each pool, V, the number of donations in each pool, W, the number of donations in each pool, W, the number of donations in each B, the method of assay, the standard used and its calibration, C, batch-to-batch reproducibility. Now, for our purposes, obviously, it's information about number of donations in each pool that's significant. I mentioned the reference to assay, the standard used and its calibration, because there was then quite a lot of correspondence about those issues. I'm not going to go through all of that. And then if we go further down, we can see 2 was about product labelling, 3, expiry date, and then 4, ongoing information is provided on the reasons for and the rate of rejection of donors or donations centre by centre. So those are similar conditions to the conditions we saw in relation to the ARMA application for Factor 8. And then 5 is the applicant should agree to the imposition of the batch release procedure. And then we see the deliberation of the main committee, advice on the evidence before them. The committee advised the grant of a product licence for this preparation for the purposes indicated in the application on condition that, and we can see the same conditions. So the committee effectively endorses the recommendation of the subcommittee on biologicals. So we've got satisfactory information on number of donations in each pool, and over the page 4 is ongoing information provided on the reasons for and rate of rejection of donors or donations centre by centre. And then if we just look at the last 2 paragraphs on that page, it was decided that if the applicant did not agree to these conditions, a letter should be sent by the Secretary in accordance with Section 21(1) of the Medicines Act. And then the committee also advised that this product should be indicated as recently introduced and should be the subject of a special directive for the reporting of adverse reactions. It's not possible to tell from the recommendations itself precisely what prompted that. We've then got, on the next page, the assessor's report that presumably went before the subcommittee and the committee. It's authored by Dr. Andrews and dated the 17th of December 1975. That's on page 9, but we'll get to that in due course. We saw a very similar report in relation to ARMA's Factor 8 application. So we can see it begins with a summary of the application. We don't need to look any further at that. If we go over the page, we can see at paragraph 3.3, under the heading Precaution and Contraindications, Dr. Andrews' report notes this: the company literature includes the usual warning about the presence of hepatitis B virus, so that's how he understands it, hepatitis B, and recommends restricting its use to Factor VIII deficiency only. And then if we go to manufacture, we see the manufacturer identified as Cutter Laboratories Inc. And then there is a section on source material, which is worth, I think, reading in full. Each plasma donation is currently tested by radioimmunoassay, RIA, for hepatitis B antigen, according to the mandatory FDA requirement as of 15th of September 1975. No reports have been received attributing hepatitis to Co8 since its introduction in February 1974. And then this on source material. The raw material is supplied by no less than 54 different firms, which are classified in the submission according to whether the firm is owned and operated by others or Cutter-owned, whether the plasma is collected by plasmapheresis or obtained from whole blood, or whether the apparatus used is owned by Cutter or the firm concerned. The list includes a number of American state prisons. So that fact was clearly known to the licensing authority at the point in time at which it considered the licence application in late 1975, early 1976. And then we're told the following criteria are established according to the Cuttam system of plasmapheresis on file with BOB, I think that says, which is presumably the Bureau of Biologics, or might be that. Suitability of the donor, immunisation, top of the next page, donor, follow-up. And then if we turn to page 8, we can pick it up. Sorry, if we go to page 7, just so that we can see what section we're dealing with. So section 7 is headed Evidence of Efficacy, and then 7.5, Summary of Accumulative Clinical Experience. So again, this is Dr. Andrews' summary of the application material. If we go over the page, paragraph 8, only 2 side effects were reported during the clinical evaluation of COAT, and then those are then described. Picking it up a few lines later, no cases of serum hepatitis were reported following treatment with COAT. In addition, no reports have been received attributing hepatitis to COAT since its introduction in the USA in February 1974. However, attached is a copy of a letter from Casper and Kipnis, and then we've got the reference in the American Journal, regarding hepatitis and clotting factor concentrates such as this product. It's one of the references used in the package insert. If we go down towards the bottom of the page, paragraph 14, in conclusion, COAT has been demonstrated to be a safe and efficacious preparation for treating or preventing bleeding in haemophilic patients with factor VIII deficiency. And then we get the medical comment, so this is presumably Dr. Andrews' comment. This factor VIII preparation would appear to have been adequately prepared and to be efficacious in clinical usage. It suffers from being prepared from multi-centre donations which cannot be properly controlled by inspection. Nevertheless, each individual donation is said to be tested by radioimmunoassay, and that the control of the blood donations is in accordance with the latest FDA regulations, copies of which are not included in the submission. The information set out is superior to that originally offered by Travenol, but in fairness, it is believed that Travenol have improved their method of manufacture in accordance with the new FDA regulations. So Dr. Andrews is there drawing attention, presumably because it is regarded as significant, to the fact that this is plasma derived from multi-centre donations. And it is presumably his own comment that those cannot be properly controlled by inspection. He then continues, in the past, the committee have recommended that the following conditions are accepted. And we can see one is relates to the donation, so the information is provided on the number of donations from which plasma is pulled for the manufacture of the product, and B, the reasons for and rate of rejection of donors or donations centre by centre, and then various other recommendations as to conditions. And then the recommendation at 9, subject to quality control being considered satisfactory and to confining the expiry date to storage at 5 degrees centigrade, the committee might feel that a product licence could be granted. And the date is 17th of December 1975.
Just going back to the top of that page. Just as a matter of curiosity, possibly for later examination when we come to dealing with some of the blood services evidence more directly, is it to be inferred from what it says about the latest FDA regulations, copies are not included in the submission, that the author did not know what those recommendations actually were? He goes on to say, in fairness, it's believed that Travenol have improved their method of manufacture in accordance with the new FDA regulations, which is slightly odd if, indeed, there isn't a copy for him to check against. Why else mention that there's a copy missing?
Yes, it's the most natural inference, I would suggest, is the inference you suggest, sir. And we can see, is there a note of scepticism, I might ask, in the language? Each individual donation is said to be tested.
Yes. By
radioimmunoassay. It's difficult. We obviously can't ask Dr. Andrews, and we don't have anything further which helps us unpick what was known to him, or indeed to others within the licensing authority at the time.
I mean, it would seem very odd if the FDA has issued regulations in this area and they weren't copied, at least to the DHSS, or they didn't have a copy, but it looks as though their medical assessor might not have had.
It does look as though that's the case. We can obviously investigate further what other material we have from the licensing authorities, from
Yes.
the department, from the MHRA, which might cast some light more generally on their state of mind.
As I say, it's really a matter for later on.
That was the medical assessor's recommendation. We've seen what the subcommittee and the committee decided. If we then pick the matter up early in the following month, at BAYP 601_110, this is a letter dated the 2nd of February 1976. It's from Dr. Andrews, who's described there as senior medical officer, and it's to the registration officer at Bayer UK. It relates to the product licence application. We can see that from the heading. You'll be pleased to hear that the above licence application has now been considered and that the grant of a product licence has been advised for the purpose indicated in the application on condition that, and then we can see the letter sets out the conditions that were identified by the Subcommittee on Biologics and endorsed by the Committee on the Safety of Medicine. So for our purposes, it's the relevant subparagraphs are 1A, satisfactory information on number of donations in each pool. Might beg the question, what's meant by satisfactory? The letter doesn't tell us, nor does the recommendation. And then paragraph 4, ongoing information is provided on the reasons for and rate of rejection of donors or donations centre by centre. So not just information such as we saw in response to the similar recommendation in the Armour application, where there was, as far as we could see, a one-off response and nothing further. This seems to suggest there's an expectation of information being submitted on an ongoing basis. There is then, if we go to BAYP 5020_008, a letter, it's from Mrs. Bolt, who was the registration officer with Bayer in the UK, to Cutter Laboratories in California. It's dated the 6th of February 1976. And it says, following my telex of today, I'm sending you a copy of the letter from the DHSS, which I refer to in that telex, together with the comments on it. So she is presumably sending the letter we've just looked at. We don't, I think, have, or at least I have not seen, what's said to be her comments on that. But again, I don't think that matters for present purposes. She continues, the number of donations in each pool need only be given approximately, but they would like to have some idea of the size of it. And then she goes on to set out what's required in relation to some of the other conditions, in particular the assay method and the standard used. And I draw attention to that simply because that becomes the subject of some prolonged correspondence. And then the next paragraph is about labelling. And then if we go to the third paragraph, point 4 of the letter means that the future, I think that probably
in the
future, they will require records on this information from the plasma collection centres. However, Dr. Andrews mentioned to me on the telephone that if this information is provided on the protocols, which will be looked at by the NIB, National Institute for Biological Standard and Control, for each batch of the product which we propose to sell in the UK, this should be sufficient information.
So does this suggest a process post-licensing of the control of distribution of the product in which the NIBSC take a look at what information has been given on pool size and decide whether it is, by whatever criteria, satisfactory?
Well, I think in relation to satisfactory, that is the adjective used at paragraph 1A of the DHSS letter.
Yes.
Number of donations in each pool, and that's what's being dealt with in the first paragraph.
But it's each pool, which means pool by pool.
Yes.
So which means that every batch made from a different pool presumably is going to go to the NIBSC if that's where records go. And then what then happens? Well, what if it's what if, assume for a moment, without in any sense knowing, that in the minds of those who are medical assessors, they put a limit of 10,000 donations to a pool, let's say. Beyond that, it's unreasonably unsafe, or something along those lines. What do they do about it?
I don't know the answer to that, sir. It's a pertinent question to pose. We do hope to have in due course some witness evidence from or in relation to NIBSC. So it may be that not necessarily by reference to this specific application, but more generally, they can provide some information in relation to that. I should just say that the reference in the third paragraph of this letter to information being provided to protocols that will be looked at by NIBSC is in relation to point 4 of the letter, and that's not pool sizes, that's rejection of donors and donations.
Of this information, I'd read that as referring to all the information that's been mentioned. I
don't think so, because I think the reference to point 4, if we go back to BAYP 601_110, so paragraph 1A is satisfactory information about number of donations in each pool. Then we've got the various other matters set out. And then point 4 is ongoing information on the reasons for and rate of rejection of donors or donations centre by centre.
So there are 2 bits of ongoing information. One is each pool, because the word is each. And ongoing information identifies ongoing information as to the performance of each centre.
Yes, I mean, certainly ongoing is clear from the language used in 4. I take your point, sir, in relation to point 1, that if you're talking about each pool, the natural expectation by the use of the word each, because that's not going to be static, is that it is provided on an ongoing basis. That doesn't appear to be how it was then understood or applied. And because if we go back to Mrs. Balt's letter to Cutter Laboratories Inc. in the States, BAYP 5020_008, her understanding in the first paragraph in relation to the pool size, paragraph line 3, the number of donations in each pool, again we see the word each, need only be given approximately, but they would like to have some idea of the size of it. So, well, it's a little unclear, I think, what was understood in relation to that. It's clear there's been some form of telephone discussion between Dr. Andrews and Mrs. Balt, because she refers to that in the third paragraph of this letter, but we don't have any records of that. If we go over the page, we can see point 5 was about the batch release procedure, and then she asks, Cutter Laboratories in the States will be pleased if you could send us your answer and comments to the 5 points raised in the letter as soon as possible, so that there will be as little delay as necessary in us being granted a product licence. So that's the internal communication. There's a response then, and we don't, I'm afraid, have all the documents, but there's a response in relation to some of this information at BAYP 5020_014. So this is Cutter Laboratories Inc. memorandum. So it's an internal communication dated the 23rd of February 1976 concerning co-ate registration in the UK. The following is in response to Mrs. Balt's telex of February the 18th, 1976. So there's clearly been some further communications in the intervening period. Her requests are restated, followed by our answers. 1, can you confirm that ongoing information will be provided on the reasons for and the rate of rejection of donors or donations centre by centre? And then this is the response internally. We do not collect information of this nature. Such information would be of dubious value in evaluating a plasma derivative product's safety or efficacy. In the manufacture of Co8, all source plasma human used as the starting material is collected and handled according to regulations described in Title 21 of the US Code of Federal Regulations. Similarly, all plasmapheresis donors must be acceptable according to the criteria described in these regulations. All plasmapheresis centres from which our source material is obtained are licensed by the US FDA. Thus, the FDA ensures that all donors and units of source plasma human are handled according to the regulations. Copies of the specific US regulations covering source plasma human and plasmapheresis donors are attached for your reference. As can be seen, only hepatitis B surface antigen negative units of source plasma human from healthy donors can be used in the manufacture of licensed biological products such as Co8. So that's what's said internally in relation to that category of information. You'll see then that the memorandum continues by dealing with a second aspect of the committee's conditions, which was the batch release procedure. Again, I don't need to go into it, I think, in enormous detail, but we can see the response there is we do not feel that the batch release procedure should be applied to Co8. And that's, and reference is made to having been licensed in the US for 10 years. If we then pick matters up, so that was the 23rd of February. If we then pick matters up, BAYP 601_111. Oh, I'm sorry, that's the wrong reference. MHRA 0009298. I'm hoping you might have. So this is Mrs. Boult's response to Dr. Andrews, 27th of February 1976. I'm now able to supply you with the information requested under Section 44 of the Medicines Act in your letter of the 2nd of February 1976. That was the letter from Dr. Andrews we looked at. Our answers to questions number 1 to 3 are contained in the appendix attached to this letter. We have not yet had a confirmation from Qatar that they will provide ongoing information about the rejection of donors or donations centre by centre. I cannot foresee that this will be a problem and will let you know further about this matter as soon as possible. In addition, they've not yet formally agreed to the imposition of the batch release procedure if necessary, but they are aware that this procedure exists in the UK and they've already agreed in principle to it. Now, there's the document that we just looked at, which is dated 4 days previously to this, was an internal Qatar Laboratories Inc. document, so internal within the US, between two employees of Qatar Laboratories Inc. It may be then that what was said in it had not yet reached Mrs. Boult when she wrote this letter, or maybe it did, in which case what she writes in this letter is not consistent with it. But we've no particular way of knowing one way or another. The appendix that she refers to then is at BAYP 601_112. Anti-haemophilic factor human Co8, and we've got the reference there to the product license number, answers to questions 1 to 3 of your letter of the 2nd of February 1976. And I think we need only concern ourselves with the answer to question 1A. Number of donations in each pool. Each pool consists of 2,500 litres of plasma. Each unit of source plasma human is approximately 600 millilitres. Therefore, the pool would be comprised of approximately 4,000 units or more. Generally, the plasma pool is such that it is comprised of approximately equal donations from at least 1,000 individual donors. And note there the words "at least," which may become significant when we look at some later material. A given lot of Co8 is usually made up from material fractionated from 3 to 5 pools, i.e. the AHF suspension obtained from 3 to 5 separate plasma pools is combined in solution to form the final product. Notwithstanding that your suggestion, sir, which may be right at least as a matter of language, that this was information to be provided on an ongoing basis, the evidence we have suggests the answer was given on this occasion and on this occasion alone. And then if we just go over the page, there's a long...
Well, just going back.
Certainly.
Where it says that the plasma pool as such is comprised of approximately equal donations from at least 1,000 individual donors, that's a plasma pool. Is it then saying that because a given lot of coated, a batch, if you like, is made up of material fractionated from 3 to 5 pools, that it would then be between 3,000 and 5,000 individual donors?
At least, yes. That's how I understand it.
So it's 3,000 to 5,000 donors is the range?
Yes.
Thank you.
But I think as a minimum, we can probably read in, given the use of the phrase at least. And then if we go over the page, say we've got product labelling. I don't need to go through the detail of it. There's a very detailed response from Bayer UK on behalf of Cutter Inc. If we go to the top of page 4, we'll see there at the top of the page reference, and this is in the context of the labelling, package insert mentions obtained from many donors. See also answer 1A to your letter above. If we then turn to BAYP 601_113, we see Mrs. Bolt writing again to Dr. Andrews now on the 4th of March 1976. And this, I think, explains what seemed curious in the earlier letter, given what we'd seen from the internal Cutter memorandum. She says, further to my letter of the 27th of February and my telephone call to you last Monday, I'm now enclosing the reply which we had from Cutter in answer to questions 4 and 5 of your section 44 letter. I'm afraid that I rather anticipated their answer in my previous letter. As you can see from the enclosed, and I don't think we've got the enclosed, so I don't think, I'll check this, sir. I don't know at present whether she simply forwarded the internal memorandum or whether that was reformulated into some other type of document. But she says, as you can see from the enclosed, they do not collect information about the rejection of donors, but the collection of plasma is carried out according to the US Code of Federal Regulations. With regards to the imposition on batch release procedure, they're not in complete agreement with it. However, as you can see from their comments, it's only certain aspects, such as the provision of samples, which they object to, and there's some further information about that. I trust that the licensing authority will now be able to continue the assessment of our application for a product license. So pausing there, we can see that by the time we've got to early March, in response to those two conditions identified by the committee, there's an answer given about pool size, which was condition 1A, which is a general one-off answer. And then in relation to the request for ongoing information about reasons for and rates of rejection of donors centre by centre, the information that's provided is simply, we don't collect that.
We can't comply with the condition.
Yes. Now, what then happens is that there's a series of further correspondence. I'm not going to go through all of it. I'll just start with one letter, BAYP 601_114. It's another letter from Dr. Andrews to Mrs. Bolt, but it's not dealing with either of the matters in relation to pool size or donor rejection. It's dealing with a number of the other issues that have been flagged up by the committee by way of proposed conditions. And the correspondence continues with ultimately, if we go to IPSN 40312_116, This is just, again, by way of example, we can see there's then a response. There have been further telephone conversations. We can see that from the opening paragraph. This is Mrs. Bolt, 20th of April. There's then further discussion about the issue of the use of the Cutter House standard, so relating to other aspects of the conditions. We go over the page. We can see that there is now agreement to the imposition of the batch release procedure. The correspondence that we have seen does not return to the question either of pool sizes or information about donor rejection. So there is no response, for example, from the department saying, well, you can't comply with that condition, and asking for more information about why, or saying, well, I'm sorry, we can't deal with the matter. We can't deal with your application any further.
What was the licence ever varied?
Well, the slightly complicating picture is Bayer withdraw their application for a licence and then SPEI would get the licence. And we don't have a complete set of documents. I'll show you what we do have. But the purpose at the moment of showing you the correspondence is to indicate that the licensing authority did pick up on and press a number of matters in relation to the conditions. But the issue in relation to the pool sizes, that seems to have been accepted as satisfactory. And the explanation is that we don't have the information in relation to rates of rejection or reasons of rejections of donors. It appears no further in the correspondence or communications. So it effectively appears to have been accepted. There's no evidence of the matter going back to the subcommittee or the committee for further consideration of that issue. Now, that doesn't mean it didn't happen, but we've not seen any documentation to suggest that it did.
So as far as we know, there was a condition to which the licence was subject, which was never fulfilled?
Yes. But as I say, the position is complicated by the fact that Bayer UK withdraw their application. SPEI would make a separate application. We don't have a complete set of documents, but I'll show you in relation to that. What I think we can say is when we look at what seemed to have concerned the subcommittee on biologics and the committee on the safety of medicines, such that they wanted these to be conditions on the licence, there is nothing that addresses those concerns other than the bare information about pool sizes. And a licence is granted and COATE becomes a concentrate distributed in the UK. It's what you might think the unsatisfactory position that eventuates is that for whatever reason, those conditions, other than the information about pool sizes, effectively fall away. There is a letter from Dr. Andrews at BAYP 601_119. Where he refers to a letter from Mrs. Bolt, 23rd of April. Again, this is dealing with the issue of calibration and the use of house standard or international standard, and not dealing with issues relating to pool sizes or donations. This shows that the licensing authority wasn't afraid to be robust when it wanted to. So on that separate issue, it's saying, what you've told us is not an adequate reply. It will be necessary for this letter to be answered satisfactorily point by point in detail before the licence can be reconsidered. Qatar may not be aware of the extent to which control of Factor VIII products imported into this country has had to be upgraded. And what that's a reference to, other than possibly the focus brought to bear on it by the World in Action documentary and the ministerial interest, is not clear. If we then go to BAYP 5020_039, we're now at July of 1976. Again, this is an internal Bayer / Cutter communication. Mrs. Boult on holiday, but have checked myself with Ministry. They intend issuing a licence to us as soon as possible. Any other minor difficulties, they say, can be settled after registration. Armour have received a licence and the product is therefore registered. I also confirmed this with Ministry. And then, if we... then the documentation becomes a little confusing. If we go to MHRA 309276, this is a document from the Committee on the Safety of Medicines to the licensing authority. It refers to Bayer UK's licence application, and we've got the name of Bayer handwritten in there, and the product licence application, which was PL/0010/0061, which is the licence application in relation to which we've been looking at the material. We then, I have somewhere got written down what the translation is of the handwriting, which I can provide in due course, but we won't go through that now. We can then see the comment at the bottom, which we saw from the document we looked at, which set out the committee's decision. The committee also advised that this product should be marked as recently introduced in MIMS and should be the subject of a special directive for the reporting of adverse reactions. And then, slightly curiously, the date that's given, or the date upon which this document is signed, is the 29th of July 1976. But that would fit with the understanding in the document that we just looked at, the telex we just looked at, that there was an intention that a licence would be issued. What then happened, if we go to BAYP 5020_040, is an issue arose, if we just look at the second paragraph of that, about the role of Spaywood. And there was a request there that the licence would be in the name of Cutter Laboratories. The label would read manufactured by Cutter Laboratories and distributed by Spaywood. I won't go into some of the further material, but it appears to have been determined that that wasn't possible. If we turn to MHRA 000928, we can see then that Mrs. Boult of Bayer, on the 18th of August 1976, wrote to the Medicines Division, so the Licensing Authority, saying, we confirm that when you receive an application for a product licence for Co8 from Spaywood Laboratories, we've no objection to your taking account of the data submitted to you by us in connection with our product licence application for Co8. At the same time, we wish to withdraw our application for a product licence for Co8 as the importation and marketing of Co8 in the UK will now be solely in the hands of Spaywood Laboratories. There is then, if we look at BAYP 5020_048, a letter from Spaywood, Mr. Heath of Spaywood, to Mrs. Boult. He thanks her for her help. He says, my visit to the Department of Health and Social Security was plain sailing, apart from the flap about the omnibus undertaking signed by Cutter. And then it would appear, and it may be that we can cast some further light on this when we look at Spaywood tomorrow, that Spaywood have handed over the licensing application that they are now making for Co8, and reference is made to some earlier correspondence. And then we see the last paragraph, Mr. Heath says, also I would like to see Dr. Andrews' reply to your letter of the 27th of February 1976 in order to judge whether or not he accepted your comments relabelling, particularly how he wants the pool size to be indicated. And certainly I So I've not seen anything further from Dr. Andrews in relation to that issue, pool size, either in terms of the substantive condition or in relation to the issue of labelling. And then if we go to I hope this is the right reference, Shomik, IPSN 40312_036. Great. So this is then the license, the product license in relation to COATE, which was granted to Spaywood. So the product license number is 3070/0004 because Bayer's application has been withdrawn. We can see the date of grant is the 27th of August 1976, although the product license actually signed on the 1st of March 1977. And if we go over the page, we can then see reference to the product, COATE. We go to the next page. We can see the manufacturer is, as we've already seen, Cutter Laboratories Inc. At paragraph 7, we can see there what's said in this application. COATE concentrate is a purified, dried fraction of pooled plasma obtained from many donors. Since the presence or absence of hepatitis virus in COATE concentrate cannot be proven with absolute certainty, the presence of such a virus should be assumed, and the hazard of administering COATE concentrate should be weighed against the medical consequences of withholding it. And then if we go over the page, we can see various provisions subject to which the licence has been granted. The first is compliance with various aspects of the relevant statutory regulations. 2 is about the number of the licence appearing on packages, package inserts and literature, etc. 3 is about usage. 4 is consistency between the specification and the finished product and the information in the application. 5 is about method of manufacture. 6 is essentially about the batch release procedure. And 7 is a further reflection of that. And then 8, again, is about withdrawal of batches if informed by the licensing authority that any particular batch and doesn't conform with the relevant requirements. So there's nothing further there in relation to the matters that we looked at in the context of Bayer's application. And we'll look tomorrow at such material as we have from Spaywood, but I'm concerned today with Bayer and Cutter. And COATE then becomes distributed in the UK by Spaywood for a period of time. So you'll see licensed then by August of 1976, but with these various issues having been initially identified at the beginning of 1976 as important and then apparently seeming to fall away. I'm going to come later to some Cutter materials which show matters relating to the state of the market over a number of years in the UK in terms of sales of COATE. But before I do that, if we can just look at 2 of the tables we looked at in relation to armour, because they also contain information at different points in time about COATE. So if we start with PRSE 0003437, this was a table showing quantities of factor VIII concentrate used in UK haemophiliacs in the years 1980 and 1981. And you'll see there, we looked at the armour figures earlier in the week, and then we've got the Cutter figures for COATE, because as we'll come on to, Cutter then come back into the scene by this time. And we can see the figures 4.935 million international units in 1980 and 3.823 million international units in 1981. So Not the same magnitude as, for example, the Armour product, but nonetheless a significant amount of the CoA8 concentrate being produced and distributed in the UK in 1980 and 1981. And then you'll see the reference there to Spaywood's product Humanate, which we'll hear more about tomorrow. If we then, in terms of licensing, move forward to 1980, BAYP 601_140 we can see this is a letter from the licensing authority to Cutter Laboratories Limited. So Cutter's UK manifestation has now made an application for a product license for CoA8. We've got the license number there, 1605/0004. The date of this letter is the 10th of June 1980. It says, I refer to your application dated 24th of January 1980 as amended by your letter of the 6th of March 1980. And unfortunately, we don't seem to have those materials in terms of the underlying application and correspondence. Authority has now been given for the grant of a product licence for CoA8, and then we've got the licence number. Reference is made to the formal documents being enclosed. We don't, I think, need to look at all of those formal documents, but if we look at one part of the enclosures at BAYP 601_142, we can see here the license itself, product license 1605/0004 has been granted to Cutter. And then if we go to the next page, we can see the particulars there set out. We don't need to go through any particular part of that. We've got the reference there just at 9 to manufacturer, Cutter Laboratories, Inc. And you'll see there the reference to Cutter's facilities in Berkeley, California and Clayton, North Carolina. I mention that only because there are a number of documents from Cutter in the states in which reference is made to those two facilities and from time to time to inspection of those facilities. If we go to the next page, we then have further provisions subject to which the licence has been granted, and they are in the same familiar and what seems to be largely standard format. So that's 1980. A licence for CoA8 is now held by Cutter Laboratories Limited. As I say, we don't, I'm afraid, have the licence application, so I can't assist with what information was provided. We can see some of the difficulties that had arisen in relation to the relationship with Spaywood. If we go to BAYP 5021_063, this is a board meeting of Cutter Laboratories Limited, so of the UK company, 16th of December 1980. And under the heading CoA8, says the whole situation regarding the present problems with sales of CoA8 was discussed extensively, including the fact that it had been impossible to sell CoA8 during the months of October and November, although it was hoped that following the reduction in price, it would be possible to make meaningful sales starting in December 1980, going through January 1981 at a price of approximately 7.2 pence per unit. Next paragraph, it was agreed that the managing director would put together a full situation report regarding CoA8 and also the Spaywood parallel product known as Humanate, which was in fact CoA8 marketed under a different label. And again, we'll come back to that tomorrow. If we look at the bottom of the page, last paragraph, it said, as regards sales from January 1981, it was thought that at the reduced price and with shading on 7-day settlement, there were good prospects for sales of fairly large lots. While this situation, and this I think is the Spaywood situation, have had an adverse effect on the 1980 figures, It was hoped that by producing a realistic sale price in the UK market, that it would be possible to ensure that the company had adequate sales, and also that it should be possible to price Humanate out of the market, coupled with the fact that NIBSAC and Dr. Duncan Thomas were very concerned regarding Humanate and the impossibility of tracing its manufacture back to its sources. And then if we go to the third page, not on the theme of licensing, but so that we don't need to come back to this document, there's just a couple of paragraphs worth looking at. Under the heading Sales, it said, it was confirmed that a number of credits were due from the US in respect of products which have had to be returned from both Oxford and St Thomas's Hospital due to adverse reactions having been obtained. At Oxford, there have been 13 cases out of 20 patients using COAT, and in the case of St Thomas's, 2 patients had contracted hepatitis. And Dr. Richard Schwartz of Cutter Inc. had authorised the immediate withdrawal of the batch. And then there's a suggestion that there might have been some lack of proper storage by Spaywood. But in any event, it's the reference there to hepatitis I wanted to flag up. And then if we go to page 5 of this document, there's a reference there to Dr. Arenstam and Trelaws. It was agreed that full investigation should go into the promises made by Carol Jones and Sidney Pugh to the Alton Centre, where Dr. Arenstam had been promised some form of financial support for a research fellowship and had put in a great deal of time and effort in putting forward a representation to the company. However, nothing materialised, and it seems that this was causing the Alton Centre to have nothing to do with Cutter whatsoever. It was agreed that this should now be looked into again with a view to the company being in a position to offer some form of financial support for such a fellowship. And so, again, it clearly relevant when you come to consider matters such as relationships between pharmaceutical companies and haemophilia centre directors. And then we can just pick up the picture in terms of Cutter's marketing of COAT at BAYP 6019_080. These are the minutes of a board meeting on the 11th of August 1981 of Cutter Laboratories Limited. There's a discussion recorded in paragraph 1 about prices. And then at paragraph 3, we can see concern being expressed at the period which existed in obtaining product licenses due to some degree to DHSS staff shortages and possibly shortcomings in the form of presentation. It was agreed that all future Cutter submissions should go through the UK company, assisted by the experts at Bayer UK, to see that future presentations complied fully with the UK requirements of the licensing authority, both as to content and format. It's not entirely clear what that's a reference to in terms of the particular license application. As I say, there were other products, so whether it's factor concentrates or a different product that might have given rise to that concern is unclear. So I'm going to move next to a further product licence in 1983 for COAT, but I note the time, so perhaps we could take a break at this stage.
Yes, well, we'll take a break now until 11:45.